Together, we can shape the intensive care unit of today and tomorrow. We reduce complexity, build connections, and create a healing environment. Our dedicated digital offering for the ICU consists of alarm distribution, silent ICU, remote care, and connected maintenance. 85 to 95% of alarms do not require an immediate clinical intervention. Relevant clinical alarms could be missed due to alarm fatigue. We are connecting urgency and accessibility with reliable alarm distribution for a safe management of critical situations. Because up to 350 alarms per patient per day can occur, we are connecting high-tech and low noise for a silent ICU and a more healing environment. Over 90,000 healthcare workers were infected in the first 4 months of the COVID-19 pandemic. Connecting mobility and accessibility to control a device from the outside and enable remote care. Up to 75% of ICU medical devices are not integrated. Let's connect uptime and operational efficiency with connected maintenance. Together, we are making the ICU of the future a reality. Let's connect for smarter care.